After 8 months, Tobago has once again reported a COVID-related death. On Monday, the Division of Health, via a release, informed that the 62-year-old female patient with comorbidities passed away on Sunday. Tobago's COVID death toll now stands at 3. One person has been discharged and no new cases have been reported in the last 24 hours. There are 57 active COVID-19 cases in Tobago. Secretary for Health, Wellness and Family Development, Tracy Davidson-Celestine, expressed sadness for the loss, adding that the medical staff did all they could. She said the division is willing to provide emotional support to the family. The health secretary stressed that it should be a wake-up call for all Tobagonians and urged persons to be vigilant and abide by the COVID-19 guidelines. The amount of cases in May is projected to cross the total cases in April. This was revealed at this morning's update on the virus. And we once again go to reporter Kimberly D'Souza to tell us more.
Epidemiologist Dr. Avery Hines says now that we are in week 19, he's hoping the measures that were implemented begin to bear fruit. But he revealed that the number of cases recorded over the past few days in May is projected to exceed the total number of cases in April. He did say that there is a slight reduction in the number of cases, but it could be daily fluctuations as the hospital capacity figures have begun to flatten. Additionally, there is now a fourth level of care for people who are recovering from COVID-19 but are not yet fit to go home. This is known as a step-down facility or halfway house between persons recovering from hospital. Principal Medical Officer of Health, Dr. Miriam Abdul-Richards, says over the weekend, the Ministry of Health and the regional health authorities added 110 beds at the ward levels to facilities at Debe, UTT, and Point Fortin. She said this allows for the freeing up of spaces in the facilities. Meanwhile, Chief Medical Officer of Health, Dr. Roshan Parasram, is encouraging everyone to get vaccinated as it can help those who cannot take the vaccines through herd immunity. This is Kimberly D'Souza for TTT News.
Thank you so much, Kimberly. Keeping with the COVID-19 theme, research shows that one of the main places that COVID-19 in Trinidad and Tobago is being spread is in our workplaces. Technical Director of Epidemiology Division, Dr. Avery Hines, highlighted this point on TTT's Now Morning Show on Monday.
That they may have been infected are in fact some of the workplace environments where people would have come to work, they came to work not feeling so well, or they came to work and then began not to feel well. So if they felt well at the start of the day, got to work and then began not to feel well.
Noted another location where those numbers are rising.
Within household, person-to-person transmission. And again, the guidelines on how to isolate yourself in your home if you feel unwell. We know it's not a natural thing, but these are things that will help to reduce that particular risk. They're things that can be done.
Dr. Hines said the simplest method to keep the numbers low is to adhere to the wearing of masks, washing hands, and social distancing.